Hi there and welcome back. Let's review attention deficit disorder. We'll get into some of the statistics, what to look for while underwriting children or adults, a couple of terms that we need to pay close attention to correlate, treatment, focus, and ultimate underwriting. So, attention deficit disorder is a disorder of attention, as we all know, but it can be with or without hyperactivity. And there is no definitive diagnostic test as we speak. Statistics: prevalence of ADD or ADHD, attention deficit hyperactive disorder, ranges from 4 to 12% in the school-aged population based on the DSM-4 criteria. It is more common in males with a male to female ratio of 4 to 1 for the hyperactive subtype and 2 to 1 for the inattentive subtype. About 50% of the children with ADHD will have another psychiatric or developmental diagnosis. Prevalence in adults is estimated to be about 2% with equal numbers for both male and female. About 90% of adults will also have a diagnosed psychiatric condition. So you will be in your daily routine confronted with underwriting children or the adults having ADD or ADHD. So try to focus on academic, social, and work. Bottom line, the functional problems. Do you notice that in the medical records? During the school years, functioning at a normal grade level without special accommodation or individual education plan related to a psychiatric disorder, is that what you are dealing with? Different data available signifies and indicates that up to age 8 or up to age 10 or up to age 18, there are different mortality experience. And hence, pay attention to the age while underwriting the children because the different data reveals different mortality issues. In adulthood, self-supporting, working without special accommodation related to a psychiatric disorder, and living independently. Those are the key aspects that you may want to look for. Familiarize yourself and pay attention to as you read APS and look out for what is called oppositional defiant disorder. That is a recurrent pattern of hostile, disobedient, defiant, and negativistic behavior towards authority figures. Likewise, what matters and we need to look for is conduct disorder, and that is repetitive and persistent pattern of behavior that violates the rights of others, including aggressive conduct that threatens others, conduct that causes property damage or loss, deceitful or theft, and serious violations of rules. These are the typical things that you would notice. Early onset predicts worse outcome and increased risk for adult diagnosis of antisocial personality disorder. Depression and anxiety alone associated with ADHD is less predictive of future problems than is the presence of conduct disorder in children especially. Treatment includes medications, counseling, behavior modification, and remedial education and tutoring. So what we need to focus on? We need to focus on the age, as stated before, and the extent or the results of diagnostic evaluations, school performance or occupational performance, other mental or nervous disorder, what are the predominant symptoms, are you dealing with any arrest history, and last but not least, how about the driving record? Do you see any driving history that is concerning? So those are the things we want to look out for. So when it comes to underwriting, bottom line, follow your company specifics and the underwriting manual that your company expects you to follow and take that route. Let's take a break here and see you soon. Take care. Bye now.